Epilepsy is a disorder of the central nervous system, which is characterized by spontaneous recurrent seizures or the tendency to have seizures. Epilepsy is now classified as generalized with aura and loss of consciousness or focal. So generalized, it could be tonic, clonic absence, atonic or myoclonic. Traditionally, a single seizure has been regarded as an indication for investigation and assessment, but not for drug treatment, unless the circumstances of the seizure necessitate it. Drug treatment should certainly be considered after two seizures, or if the second seizure follows closely from the first. A type of drug used usually depends on the type of seizure. And drug treatment of epilepsy should be guided by the following general principles. They begin with a single drug at the lowest dosage range and increase the dose gradually to the upper limit of the dosage range until side effects appear. And if seizures are not controlled, subsequently, if the seizures still remain uncontrolled, change to a different drug by gradually reducing the dose of the initial agent while simultaneously introducing the new one. This usually takes 3 to 4 weeks. So try 3 separate drugs in this fashion. If no clinical response is observed, before resorting to drug combinations. Anticonvulsant drug treatment can be totally withdrawn gradually in a patient with epilepsy only after a 2-year seizure-free period and after a full evaluation and discussion with the patient. So patients with epilepsy should be advised not to drive a vehicle if not certified to be seizure-free. Swim alone, work at heights, or operate machines, cook in open fire alone, or ingest alcohol excessively. So the causes usually idiopathic, meaning unknown. The symptoms, just like seizures, loss of consciousness, tongue biting, foaming at the mouth, incontinence of stool or urine, aura, which may include a strange gut feeling, somatosensory manifestations, visual, olfactory, gustatory, or auditory, and for example, strange smells or flashing lights, and also muscle twitching and movements, which may be focal or generalized. So after a seizure, the patient may be confused, that's post-ictal confusion, or may sleep for some time, that's post-ictal sleep. The signs that are usually elicited are the same for seizures, which are a prodrome or aura with automatism, lip smacking, picking at items, muscle twitching and movements, which may be focal or generalized. Post-ictal sleep, post-ictal confusion, thoughts paralysis, a stroke, like weakness, which may rarely occur. Also, examine carefully for evidence of neurological localizing signs, tongue laceration, and evidence of trauma to the face or other parts of the body. Okay, so investigations to, just like seizures, you do an FBC, ESR, blood glucose, B, calcium, LFTs, chest X-ray, electroencephalogram, as EEG, CT scan of the head if necessary. Treatment objectives are to stop the seizure, to treat underlying cause, and to prevent injury. Non-pharmacological treatment, remove sharp objects, fire, among others, away from the patient during seizures, and ensure clothing around the neck is loose. Ensure the airway is clear. Wipe or suction any secretions or vomiters from the mouth or nose, and do not force a spoon or tank the present into the mouth, and remove false teeth if present. After convulsions cease, turn the patient into semi-prone position by turning the patient on the side with one leg bent and the other leg straight. You monitor fits. You can use a fits chart. So pharmacological treatments for the maintenance management of epilepsy, as in acute generalized seizures, we give phenytoin IV in adults 10 to 15 milligrams per kilogram, start over 20 to 30 minutes, and then 100 milligrams 6 to 8 hourly. PRN, as in children 3 to 5 milligrams per kilogram any, or you can give phenobarbital daily IM in adults 60 to 180 milligrams at night, in children 2.5 to 5 milligrams per kilogram daily by slow IV or oral. Or you can give carbamazepine in adults 100 to 200 milligrams once or 12 hourly, and then increase gradually to 0.8 to 1.2 grams 8 to 12 hourly. In children 1 month to 12 years, give 2.5 to 5 milligrams per kilogram at night or 12 hourly, and increase when necessary. And then maintenance, you give 5 milligrams per kilogram 8 to 12 hourly. Or you can give sodium valproate 12 hourly, and in adults 600 milligrams with a maximum dosage of 2 grams. In children more than 12 years, you give 600 milligrams with a maximum dosage of 2 grams. And 1 month to 12 years, you give 10 to 15 milligrams per kilogram daily or 2 divided doses. And then maintenance dosage, give 25 to 30 milligrams per kilogram daily in 2 divided doses. Or you can give lamotrigine in adults 25 to 50 milligrams 12 hourly, in children 25 to 50 milligrams daily. Or you can give levetiracetam. Okay, so levetiracetam in adults, you give 25 to 50 milligrams 12 hourly, in children 25 to 50 milligrams daily. The management of epilepsy is in generalized absence seizure. Sodium valproate, give 8 to 12 hourly, in adults 600 milligrams with a maximum dosage of 2 grams, in children more than 12 years 600 milligrams, just like adults, with a maximum dosage of 2 grams. 1 month to 12 years, we give 10 to 15 milligrams per kilogram daily for or 2 divided doses, and with a maintenance dosage of 25 to 30 milligrams per kilogram daily in 2 divided doses. Or you can give etosuzumide. So etosuzumide daily in adults 250 milligrams 12 hourly, and increase by 250 milligrams every 5 to 7 days to 1 to 1.5 grams daily in 2 divided doses. Also, in children more than 6 years, we give 250 milligrams 12 hourly, and increase by 250 milligrams every 5 to 7 days to 1 to 1.5 gram daily in 2 divided doses. From 1 month to 6 years, give 5 milligrams per kilogram with a maximum dosage of 1 to 5 milligrams 12 hourly. The management of epilepsy, that's in focal seizure, you give carbamazepine oral in adults 100 to 200 milligrams once or 12 hourly, and then you increase gradually to 0.8 to 1.2 gram 8 to 12 hourly. In children 1 month to 12 years, Give 2.5 to 5 milligrams per kilogram at night or 12 hourly, and you increase when necessary, and then with a maintenance dosage of 5 milligrams per kilogram, 8 to 12 hourly. Or you can give sodium valproate, 8 to 12 hourly in adults, 600 milligrams, the maximum dosage of 2 grams. In children more than 12 years, give 600 milligrams, just like adults, the maximum dosage of 2 grams. 1 month to 12 years, give 10 to 15 milligrams per kilogram daily, or 2 divided doses. And then you give a maintenance dosage of 12.5 to 15 milligrams per kilogram, 12 hours. So where available, slow release preparations are preferred. No patients with epilepsy should receive continuous education and counseling by the pharmacist. So referral criteria: refer all patients with intractable seizures to the specialist.